Hello, and welcome to Medicare. My name is Paul Doherty, and I am a Medicare volunteer with Southern Maine Agency on Aging. We are mission-driven and donor-supported, so you do make the difference, and a $40 donation is gratefully suggested. Thank you. Southern Maine Agency on Aging is a not-for-profit 501c3 organization with some paid staff and a huge pool of volunteers. We get our funding from grants, federal and state-funded contracts, private sources, and donations. This enables us to offer a wide variety of programs and services for older adults. And you can see that there's quite a list here. And to find out more, please check us out online at www.smaa.org. So, what do we plan to cover in our Medicare presentation? We will explain just what Medicare is, how and when to enroll in Medicare. We will talk about Original Medicare Parts A and B, along with Medicare Supplement Insurance or Medigap, and Part D prescription drug coverage, Medicare Advantage plans, which is Part C, and then share some places to go for additional resources and to answer any questions you might have. And so you may want to have a pad of paper and a pen or pencil handy to jot down any of those contacts or anything else that you want to make special note of. So first off, what is Medicare? Medicare is a health insurance program serving adults who are 65 years of age or older, those under 65 considered disabled under Social Security provisions, people of all ages with end-stage renal disease, as well as those with ALS, more commonly known as Lou Gehrig's disease. Medicare is provided by the Centers for Medicare and Medicaid, and enrollment is handled by the Social Security Administration or the Railroad Retirement Board. Initial enrollment in Medicare is usually automatic for those receiving Social Security benefits at age 65. Those receiving Railroad Retirement Board benefits are those in at least their 25th month of disability benefits. All others must enroll themselves. The Medicare initial enrollment period for doing so begins 3 months before the month you turn 65, continues through that month, and then goes 3 more months after your 65th birthday month for a 7-month initial enrollment period. During this time, you can enroll in Parts A and B, a Part C Medicare Advantage plan if you have both Parts A and B, a Part D drug plan if you have Part A and or Part B, and a Medigap policy if you have both Parts A and B, all of which, or I should say all with no late enrollment penalties, and all of which I will explain during the course of our presentation. Other Medicare enrollment periods include an annual general enrollment period from January 1st to March 31st, with coverage effective the following July 1st, and where penalties may apply. Special enrollment periods may also apply if you did not sign up for Part A and or Part B when you were first eligible, because you were covered at the time under a group health plan based on your current employment. In that circumstance, you can sign up for Part A and or Part B anytime you are still covered by the group health plan, as well as during the 8-month period that begins the month after your employment ends or your coverage ends, whichever happens first. And please note that COBRA and retiree health plans are not considered coverage based on current employment. So if you are eligible for Medicare and you are currently have employer or union coverage, you can find out how your insurance works with Medicare by talking with your employer or union benefits administrator, as well as requesting a creditable drug coverage letter for enrollment in a Part D drug plan without penalty. This is a chart of that Medicare special enrollment period we referred to, where you have 8 months from the time you decide to leave your retirement or employer group health plan or it ends. During the 8 months, you can enroll in Medicare Parts A and B, usually with no late penalties. Just keep in mind that even though you have 8 months, the sooner you enroll during that period, the better to avoid any gaps in your health coverage. Now let's take a look at your Medicare card, which is sent to you when you are enrolled. If you keep it, you are accepting both Parts A and B. If you do not want Part B, you return it. There are instructions on the back of the card. The cards are fairly recent, with the biggest change being that your Medicare number is now a distinct number rather than your Social Security number as it had been before. So if you've been on Medicare for a while, you have a Medicare card and you've had it for a while and it still has that Social Security number and you've never received a new card, then you should contact Medicare as soon as possible. So now you need to decide how you want to get your Medicare coverage. And there's a couple of ways. The first way on the left on our slide is directly through Original Medicare, including Part A hospital coverage and Part B medical insurance. Then you must decide if you want to pick up a Medicare supplemental insurance or Medigap policy, as well as a Part D prescription drug plan. The other way, which is shown on the right, is through a Medicare Advantage plan, and we will go over that a bit later. But right now, let's keep on going with Original Medicare. But first, let me mention how Medicare works if you're currently on one of the health insurance marketplace plans created by the Affordable Care Act. If that is the case, you should enroll in Medicare as soon as you are eligible and cancel your marketplace coverage. You cannot keep your marketplace plan when you enroll in Medicare unless you have to pay for Part A yourself. You should notify your plan in the marketplace at least 14 days before you want your marketplace coverage to end. And please note that it is illegal for anyone to try to sell you a marketplace plan if you have Medicare. So now getting back to our Original Medicare, let's take a look at what is covered by Part A. It covers inpatient hospital stays, skilled nursing facility care, home health care, hospice care, and blood transfusions, particularly all the various services that you see listed here on the slide. Part A costs for 2020 have been paid during the work years of most Americans who must have the equivalent of 40 quarters under Social Security or railroad retirement. Part A has a benefit period deductible of $1,408 with a $0 copay for the first 60 days of each benefit period and a $352 copay per day for days 61 to 90 of each benefit period. Skilled nursing facility costs include a $0 copay for the first 20 days of each benefit period and a $176 copay per day for days 21 to 100 of each benefit period. One very important thing to keep in mind in all of this is to know whether you are indeed an inpatient or an outpatient. Your hospital status as inpatient or outpatient affects how much you end up paying out of pocket, what is covered by Part A and or Part B, and whether Medicare will cover subsequent skilled nursing facility care, which requires a certain minimum number of inpatient days to qualify. You are only considered an inpatient if you have been formally admitted by doctor's order, with the day before you are discharged considered your last inpatient day. If you have not been formally admitted because you are under observation or for any other reason, then you are still an outpatient, even if you've stayed overnight. You should get from the hospital a Medicare outpatient observation notice whenever your observation status exceeds 24 hours, but before the 36th hour. At any rate, it is important to be aware of your status during any hospital stay. Now let's move on to Part B. Part B typically pays 80% of doctor's services, outpatient medical and surgical services and supplies, diagnostic tests, outpatient therapy, clinical laboratory services, home health care, durable medical equipment, blood transfusions, ambulance service, if medically necessary, outpatient mental health services, some preventive care services, and limited outpatient prescription drugs. It also covers, as we said, certain preventive services and covers them 100%. And they include, among others, bone mass measurement, colorectal cancer screening, diabetes services and some supplies, glaucoma testing, screening mammogram, Pap test, pelvic exam, clinical breast exam, prostate cancer screening, vaccinations, including those all-important flu shots, tobacco cessation services, cardiovascular screening, and the annual Medicare wellness exam, among others. As we said, you can see the full list of covered preventive services in your annual Medicare and You handbook. As for the costs of Part B coverage in 2020, in 2020, which you may not know if you are new to Medicare, the monthly premium is $144.60. However, if your annual income exceeds $87,000 as a single or $174,000 as a couple, you may end up paying a higher premium. But the key word here is may. The annual deductible in 2020 is $198 with a 20% coinsurance for most services, leaving 80% to be picked up by Medicare. There is financial aid available for folks who qualify based on low income, including the Medicare Savings Program and Low Income Subsidy, extra help. So, perhaps your question right now may be, if Medicare pays 80%, who pays the rest? Well, that could be you, but this is where a Medicare supplement insurance or Medigap policy may come in. These policies, which are sold by private insurance companies that must follow federal and state laws, and which must actually say Medicare supplement insurance, cover those gaps in original Medicare coverage. There are currently 10 standardized policies available for 2020, A through D, F through G, and K through N, with each person having his or her own policy. However, please note that plans C, F, and high deductible F cannot be sold to newly eligible individuals as of January 1st, 2020. The key word there being newly. So, if you are on Medicare or you turn 65 before January 1st, 2020, you are grandfathered in and so continue to be eligible for those plans. Here's a chart of the Medigap plans. Please note once again that plans C and F are shaded as they are not available to those newly eligible. But let me also add that Plan D is largely replacing Plan C, and Plan G is largely replacing Plan F minus the Part B deductible. As for the cost for these plans, you will see under each plan a range of costs, since the different companies that offer these plans must provide the same benefits, but can charge different prices for their plans. So for example, if you choose a Plan D, your monthly cost will range anywhere from $203 to $299, depending on which company you choose for that plan. Also, please note that plans K and L feature an out-of-pocket maximum. One more thing, all these plans are administered by the Maine Bureau of Insurance, and any questions you may have about them can be addressed to that bureau. Their contact information is included in the list of resources at the end of our seminar. Now let's move on to Part D prescription drug plans, which are also administered by different private companies. Since that is the case, there is actually a monthly premium range for 2020 of $13.20 to $84.10, depending on what each company is charging. And once again, those with single income levels over 87,000 or couples income levels over 174,000 may pay higher monthly premiums. As for deductibles, many Part D plans have no deductible. Otherwise, there is again a range, but the maximum deductible any plan can charge is $435. In addition to your initial enrollment period, the time to enroll in Part D plans includes the annual open enrollment period from October 15th to December 7th. There are also special enrollment periods if you move out of your plan service area, you lose other creditable prescription drug coverage, or you qualify for MaineCare. And you can find all the Part D plans offered in Maine in your Medicare and You handbook. We just referred to that annual open enrollment period running from October 15th to December 7th each year, with any actions taken then effective the following January 1st. This is important. This is basically the Medicare free-for-all period when you may join, drop, or switch Part C and Part D plans, which also makes it the perfect time to review what you have, as well as what other options there may be, a review that can often lead to better coverage and/or lower costs to you. Here are the 4 phases of your Part D coverage, beginning with the initial phase that may or may not apply to you depending on whether or not your plan has a deductible. If so, then you pay 100% of drug costs until that deductible is met. Next, we see what is referred to as the coverage gap, also called the donut hole. Most Medicare drug plans have this donut hole, but not everyone will enter it. Basically, it begins after you and your drug plan have spent a certain amount for covered drugs, which is $4,020 in 2020. People with Medicare who get extra help paying their Part D costs will not enter the coverage gap. But for those who do enter it, you will then pay no more than 25% of the cost for your plan's covered brand name and generic prescription drugs. But although you will be paying no more than 25% of the cost of brand name drugs, almost the full price of those drugs will count as out-of-pocket costs to help get you out of the coverage gap. So what you pay and what the manufacturer pays will count toward your out-of-pocket expenses for brand name drugs. It's a bit different for generic drugs. In that case, you will again pay only 25%, but only the amount you are paying will count toward getting you out of the coverage gap. Either way, once you have spent $6,350 out of pocket in 2020, you are out of the coverage gap and automatically enter what is referred to as catastrophic coverage, where you will pay approximately 5% of retail drug costs for the remainder of the year. And you can log into Medicare.gov for more information about the coverage gap, or the donut hole as it's also called. Now we get back to those two choices for getting your Medicare coverage, and can talk about that second one on the right there through a Part C Medicare Advantage plan. These plans also offer Parts A and B, as well as usually offering some Part D drug coverage. If not, then you may also need to pick up a Part D drug plan. One thing you will not be able to pick up is a Medigap policy, since you cannot have both a Medicare Advantage plan and a Medigap policy. These Medicare Advantage plans are substitutes for original Medicare, in which the federal government has basically outsourced the administration of Medicare benefits to private insurance companies. They generally offer HMO, HMO, POS, PPO, or PFF style coverage, PFFS style coverage, and there are also special needs plans for chronic condition, institutional, and dual eligible. So again, Medicare Parts A and B are administered by the company you choose, which usually includes a Part D prescription drug plan as well. In addition, other options not usually offered by Medicare may be offered by a Medicare Advantage plan, such as dental, vision, hearing, foreign emergency travel, and annual physical coverage. As it was with Part D drug plans, the costs vary by plan and are determined by the insurance company you choose, with again those 87,000 and 174,000 single or couple income limits may be leading to higher premiums. Deductibles are also determined by each company. Like everything else, you can enroll in Medicare Advantage during your initial enrollment period, as well as during the annual enrollment, open enrollment period. There are also special enrollment periods for when you move out of your plan's service area, you qualify for main care, or you wish to enroll in a 5-star plan. And there is also an annual enrollment and disenrollment period, which has been expanded from the former Medicare Advantage disenrollment period that ran from January 1st through February 14th. It's now about twice as long, running each year from January 1st to March 31st. During this period, you can switch from the Medicare Advantage plan you are in to another Medicare Advantage plan, or you can switch out of your plan to original Medicare with or without a Part D drug plan. Any changes are effective the first of the following month. The one thing you cannot do during this period is switch from original Medicare to a Medicare Advantage plan. Medicare Advantage pays a varying percentage of pretty much the same services as original Medicare, including, once again, doctors and hospital services, outpatient medical and surgical services and supplies, diagnostic tests, outpatient therapy, clinical laboratory services, home health care, durable medical equipment, blood transfusions, medically necessary ambulance service, outpatient mental health services, and some preventive health services, which include bone mass measurement, colorectal cancer screening, diabetes services and some supplies, glaucoma testing, screening mammogram, pap test, pelvic exam, clinical breast exam, prostate cancer screening, vaccinations, tobacco cessation services, cardiovascular screening, and the Medicare annual wellness exam, among other things. Once again, each plan sends out an annual handbook where you can find the full list of covered preventive services as well as other important information pertaining to that particular plan. Some good questions to be thinking about and that you need to ask if you are considering Medicare Advantage and which plan to choose. What will you pay for premiums, deductibles, copays, and co-insurance? Is there a limit on out-of-pocket expenses incurred in a year? And what expenses count toward that limit? Does the plan have a network, as many plans do, where you need to use network providers and other services to be covered? So more specifically, is your primary care physician, any specialists you may see, the hospitals you may use in the plan's network? And are all your prescription drugs listed in the plan's formulary, which is a list of drugs covered by the plan? Plans don't necessarily cover every drug you may need to take or may have certain restrictions in place for certain drugs. And that, by the way, is also an important consideration in looking at Part D drug plans, which also have formularies and restrictions. And once again, you can find a listing of all Medicare Advantage plans available in Maine in your Medicare and You handbook, which, if you haven't noticed already, is a great resource for all kinds of important Medicare information. So, now what Medicare decisions does all this lead you to have to make? Do you want original Medicare or a Medicare Advantage plan? Should you sign up for Part A? And should you take Part B? And if not now, when? What about a Part D drug plan? Do you need a Medigap policy, which is only a choice if you are taking original Medicare? And can you get help with Medicare costs? Also, if you are eligible for Medicare and currently have employer or union coverage, you need to see how your insurance works with Medicare. Information you can once again get from your employer or union benefits administrator, who again is also the source for that creditable coverage letter for your prescription drug plan. And don't forget those marketplace rules we talked about earlier. So I'm guessing you may need more information or you may have questions, and that's no problem. And here's where that pen or pencil and paper may come in handy. Here are some good resources for Medicare-related information, including the websites of the Centers for Medicare and Medicaid Services and the Kaiser Family Foundation. Take a moment to jot those down if you wish. There is also the 2020 Medicare and You Handbook and Plan Finder we've mentioned several times, as well as information and a Plan Finder on Medicare's website itself, which is www.medicare.gov. And finally, there's the website for the Maine Bureau of Insurance that I mentioned for more information about Medicare supplement insurance in Maine. So again, make sure you jot down whatever you feel you may need here. Also, you can follow up with us, good folks, here at Southern Maine Agency on Aging by calling either the local or toll-free number listed below. In this way, you can sign up for a one-on-one Medicare counseling session, as well as a one-on-one medication review if you have high medication costs. And we certainly invite you to tell all your family and friends about SMA and all the many programs we offer to York and Cumberland County older adults. Got those numbers? Good. And once more, here's that all-important website for Medicare, www.medicare.gov. Well, we have covered a lot of territory, and I hope this has answered most, if not all, your questions. But this is really only meant to be an introduction, so please check out the resources and give us a call at SMA if questions remain. For all of us at the Southern Maine Agency on Aging, stay well, and thank you.